Hello, this is Dr. Neil Baum from New Orleans, Louisiana, and I want to take a few minutes to talk with you about some element that I think is going to take place in the future of medicine and particularly in the field of urology, and that is at-home testing. So what's the future of at-home testing? Well, COVID-19 created multiple paradigm shifts. It has made the possibility of taking care of patients using telemedicine and be able to take care of patients without the necessity of examining the patients. At-home testing is going to be convenient for patients, and I hope to be able to show you it's economically advantageous to not only to patients, but also to urologists as well. In this 6-minute video, I will discuss why at-home testing will become more common. I'll give you the advantages and disadvantages of at-home testing. And I'm going to share with you what I think in the future will be some urologic applications for at-home testing. So what are the pros and cons of at-home testing? Well, the pandemic made it possible for home laboratory testing to be attractive to patients because they wanted to avoid exposure to COVID-19 and they didn't want to come to the office. At-home testing is certainly convenient for patients and it can be done cheaper than having to go to a laboratory. Some at-home testing will even offer support via telemedicine after the testing is done for patients who have any questions. Also, at-home testing is going to be a boon for the uninsured Americans to obtain access to healthcare because of its convenience and because it is less expensive. Have to be very careful about at-home testing. We only have to recall the Theranos debacle with Elizabeth Holmes, who is currently awaiting an upcoming trial for multiple wrongdoings. The disadvantages of at-home testing is that some of these at-home tests are not FDA approved. Some at-home testing requires background information of the patient's age, family history, and comorbid conditions, and the necessity to have a doctor explain the outcomes or the results. Also, many tests cannot be conducted on just a single drop of blood. Current examples of at-home testing, including the pregnancy test, the finger prick for diabetes. Also, there are semen analyses that will confirm sterility after a vasectomy. There is genetic testing is currently available, and also testing for food sensitivity. The science of at-home testing is it can be done for microbiome testing, the BRCA gene and focused genetic testing, tests for gluten and peanut sensitivity, can be used for screening for IBS and celiac disease, fructose and lactose intolerance, and also genetic testing in addition to the testing to explore one's family tree. There are going to be some applications in urology to at-home testing, including a semen analysis for an infertility evaluation, which will include the volume of the semen, the count in the ejaculate, and include also motility and morphology. It's going to also be available for a hematuria workup and also for a urinary tract infection diagnosis and follow-up. It will also be available for hormone testing. And soon to be on the horizon is the liquid biopsy for PSA screening and follow-up that does not require a prostatic massage. Also, there will be home testing as a screening and monitoring for bladder cancer, for checking the white count for patients who are undergoing chemotherapy, and certainly for COVID-19 screening and antibody testing. My take home message is that in the past, the patient went to the lab for testing. In the very near future, the lab is going to be coming to the patient, particularly to the patient's home. The bottom line is that at-home testing shifts from reactive to proactive healthcare. It will be an example of new methods of caring for patients. And even after the pandemic has been solved, remote healthcare is here to stay. I hope you found this video on the future of medicine and the future of at-home testing useful. If you have any comments or suggestions, please let me hear from you at the email address provided on the last slide. Thank you.